One of the most common topics that are talked about during pregnancy is regarding your water breaking. Today we'll be telling you everything you need to know about what happens when your water breaks and what to do about it. So click those like and subscribe buttons and stay with us. Water breaking is also called rupture of membranes or rupture of the amniotic sac. This is when the amniotic sac, or the bubble that your baby has been living in, breaks and fluid comes from your vagina. The amniotic sac protects your baby during pregnancy, and that water is what they live in. When your water breaks, it indicates that delivery is imminent. It can occur before labor, during contractions, or right before delivery. There are many signs to look for to let you know your water has broken. The first one and most common is a popping feeling, and that's followed by either a gush or a trickle of fluid. You may have clear or pale yellow odorless fluid. Sometimes all you're going to feel is a trickle down your leg, or your underwear may be soaking wet. It's also important to understand that when your water breaks, you cannot control the flow of the fluid. It's continuous leaking that cannot be held in. If you're at home and you're not sure if your water has broken, start by putting on clean underwear or a sanitary pad. Then lie down and stand back up. And if fluid starts leaking, that's a good sign your water may have broken, but you definitely need to get checked. Your healthcare provider can confirm with a variety of methods, including a vaginal exam to look and see if we see water, labs, and even paper tests. The cause of your water breaking is not fully understood. It may involve hormonal changes or fetal signals. There's no specific signs to indicate when your water will break, and it often happens during labor. Please remember to hit the like and subscribe button so you can get our latest content. Premature rupture of membranes, or PROM, is when your water breaks before 37 weeks of pregnancy. There are many risk factors, including smoking, infections, a previous PROM, or short cervix. The treatment options for this include antibiotics, steroids, magnesium sulfate, or even early delivery of your baby, depending on the gestational age. After your water breaks, delivery will typically happen between 24 and 48 hours, although it varies on a lot of things depending on your pregnancy stage and your health. Up to 90% of women will experience labor before their water breaks, but your contractions may get more intense after it breaks. Now, the water must be broken for a vaginal delivery. It is not needed to break ahead of time for a C-section. If your water has not broken when you're in the middle of your vaginal delivery, an amniotomy may be performed. This is where your healthcare provider will break the water for you. And they do this especially if your labor stalls or to try to speed up your delivery. It's possible you may not notice if your water breaks because the fluid can leak gradually. So the second you suspect anything, please make sure you contact your healthcare provider. The amount of fluid varies, so remember it could be small trickle or a large gush. Again, if you're not sure, contact your healthcare provider. Symptoms to report include fluid leaking, fever, foul smell, blood, or changes in fetal movements. You need to tell your doctor about the amount of fluid, the color and the smell of the fluid, and the time since the water broke and the presence of contractions, because early water breaking can lead to infection. I hope this video has helped you learn everything you need to know about what happens when your water breaks and what to do about it. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Remember to share this video with your friends and family and follow us on Facebook and Instagram for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.